Welcome back to the channel. If you didn't get a chance, I will put in the show notes below last week's video on thyroid hormone testing, and I'll try to finally figure out how to get one of those YouTube cards up in the corner as well. For today's content, we will be looking at 3 simple steps that I like to use to assess low thyroid hormone production from a functional medicine standpoint. Also, if you stick around to the end of this video, I will be sharing with you my 2 favorite supplements to help increase thyroid hormone production. Okay, let's get into today's talk. Medical history. So we want to assess all of these signs and symptoms in each one of the patients. So create your own checklist for yourself. If your doctor's not going to do it, your provider's not going to do it for yourself. Some of these things can be very subtle, and so you might not notice some of these things. So, as you start thyroid hormones, or if you start supplementation, get yourself a baseline of these symptoms. Give yourself a 1 to 10 rating scale, whatever you need to do to track those symptoms for yourself. Brittle nails, I see that all the time. We'll talk a little bit more about that later. Classic sign, cold hand, cold feet, not getting good circulation. We'll talk about heat production in a minute. Constipation, that's a big one. A lot of patients that come in, they have low thyroid, and their iron is also low. And I tell them, don't worry, I'm going to give you iron. And they're like, no, I don't want to be more constipated as I already am. But you can give the patient the right kind of iron. It'll fix their constipation because it actually fixes your thyroid, which gets you pooping again. So something that would normally be sought as constipating, you can actually resolve constipation with. Difficulty swallowing, that could be because that thyroid gland is enlarged. Dry skin, elevated cholesterol. I've seen that a lot in patients' labs. Once we get their thyroid working well, their cholesterol level goes down. Yep. Eyelid swelling. I'm not going to read the rest of the list. Hair loss, infertility, so on and so forth. This will all be online. But just so you know, there's just more than just, oh, you're feeling tired. So measuring basal body temperature. So that's the other handout that you all should have got tonight. Thyroid's main function, the main function is in every cell in the body, is to create metabolism. When you have metabolism, you, as a byproduct, produce heat. So if you're cold and your body temperature is below the normal range, that is a strong indicator. That's a strong, give me that back. No, I'm just kidding. That's a strong indicator that you might have hypothyroidism. So we want to be measuring our body temperature. Super, super important. Like if there's one, if you didn't want to spend any money on testing, I mean, you probably have a thermometer at home. Patients have come up to me after the seminar. I've given this before in years past, and like, why does it have to be a mercury thermometer? Just whatever thermometer you have at home is going to be just fine. Yeah, just something. Yeah, I would. Well. Yeah, I would still encourage you to do like in the instructions of doing a regular like oral thermometer, or stick it under your armpit, that kind of thing. Yeah. Hypothyroid individuals often complain of feeling cold hands, cold feet, intolerances to hot or cold. The other thing too, enzymes, vitamins, minerals, they all have this specific range where they work the best. And it's a narrow range. If you get we all think of fevers, we feel crappy, but no one ever talks about when your temperature is low. Like whoever talks about, oh, I'm a degree below normal. I'm 2 degrees below normal. It's just not even talked about. So if your temperature is below, again, optimal is 97.8 to 98.2, even 98. I was always taught 98.6 in school. So maybe let's bump that up to 98.6. But the point is, if you're below that 97.8, we should be looking at thyroid function and doing more of a thorough workup on that particular patient. Physical exam. I love this one. It's the outer third of your eyebrow that's missing, gone, thinned out. That's a classic sign. Edema around the eyes, periorbital edema, dry skin, slower heart rate too. Again, your metabolism it's like the thermostat of your body, right? It's just not set to that level that it needs to be. Everything's going to be slow. Slow GI tract, constipation, so on and so forth. I hope you found those 3 steps beneficial in assessing your thyroid function. All right, so as I promised earlier in this video, what are the 2 simple supplements that you can take to help build more thyroid hormone. The 2 favorite supplements that I recommend the most, iodine and selenium. Now before you run out to the store and get those, I encourage you to talk to your medical provider before starting any supplementation. If you want to learn more about thyroid hormone production, I encourage you to check out my video entitled How to Get My Thyroid Gland Producing More Hormone. Hopefully you found value in today's content. If so, I would encourage you to subscribe to our channel and of course give this video a thumbs up. Thank you. We'll see you next time.